Hi there, I'm Dr. Jim. My topic today is multiple sclerosis and the risk for suicide. Research has found an association between depression, suicide, and a diagnosis of multiple sclerosis. This neurodegenerative disease causes many physical, emotional, and cognitive problems that negatively impact how a person functions, as well as their quality of life. The risk for suicide is high due to the presence of depressive symptoms, isolation, and reduced independence. Multiple sclerosis is a chronic disease of the central nervous system that causes a wide range of disabling problems stemming from disruptions between the brain and the spinal cord. It's also considered an immune-mediated disease as it attacks myelin that covers nerve fibers and eventually destroying them. Symptoms of MS include numbness or weakness in the legs or the trunk, feelings of electrical shock that occur with movement, tremor, loss of vision, and other vision-related problems, slurred speech, fatigue, sexual problems, and bowel and bladder difficulties. Lots of completely different systems, brain, body, immune system, nervous system wide. Depression and MS, there's a big connection. Depression is one of the most common symptoms associated with multiple sclerosis and is a risk factor for suicidal thinking and behaviors. Physicians and other healthcare providers should be prepared to discuss depression and suicide in people that they are treating. It's a very difficult topic to approach, but one that is vital to the well-being and the safety of the person with MS. It appears that depression is more common in women with MS than it is in men. Depression can be associated with changes in the brain, as well as psychosocial factors, including poor coping and loss of hope. There are some warning signs. The majority of people diagnosed with MS and have successfully committed suicide did so shortly after seeing their doctor or another healthcare provider. Watching for warning signs and knowing how to respond to them are very crucial. Some people will verbalize their feelings of sadness and hopelessness and make statements like, "I don't want to be a burden to my family anymore," or "I can't do what I really love to do anymore, so why go on living?" Others may not be as vocal. So there are some red flags to watch because they're not talking about it. Sudden changes in their health or behavior, like increased consumption of drugs or alcohol or becoming socially withdrawn. Positive depression screening. Intense signs of ongoing bereavement each time the individual is seen. Inadequate support systems within their family, their circle of friends, or caregivers. Worry about being a burden. Concerned family members and friends are expressing that this individual with MS may be suicidal. So how do you respond? Keeping a careful eye on individuals diagnosed with multiple sclerosis who are depressed and potentially suicidal. This is only the beginning. The medical provider must also know how to sensitively and effectively respond to signs, symptoms, and red flags for depression and suicide. It's important to assess the individual's safety, of course, and their environment. Schedule more frequent appointments and include their family if possible. That's a good intervention. Limit prescriptions to only 30-day supplies to avoid the risk of overdosing on medications that they're taking. Consult with psychological professionals to address depression, anxiety, sleep difficulties, and substance abuse. Ask the right questions, like, do you ever think about harming yourself? Do you have any guns at home? Important questions. Here's my takeaway. MS is a very serious, debilitating, chronic, degenerative disease that's associated with negative effects to the person's physical as well as emotional well-being. Depression most often accompanies MS, and is a major risk factor for both suicidal thoughts as well as actions to end one's life. Knowing the warning signs and the red flags can be helpful in identifying risk for suicide and self-harm. Responding to one's cry for help may save a life. I'm Dr. Jim. We have to critically think about these things: MS and risk of suicide. Thank you so much for your attention. Keep coming back for more, and forward this to a friend or colleague.